All right, good morning. It's February 24th. This is a special session of the Jefferson County Commission. The purpose of this session is to discuss the disparity in the state distribution of the COVID-19 vaccine to Jefferson County. So I know we have local officials from the County Commission, multiple mayors on, folks from the health department. We would have held this meeting sooner, but per the Open Meetings Act, we have to have 48 hours notice. And this, unfortunately, was not an emergency meeting to be justified for that. There has been significant headway made over the last 2 days. I know myself and fellow other elected officials and staff have inundated the governor's office regarding this problem. So I think we have, before taking public comment, I just want to note that Jefferson County is supposed to be slated to receive 1,780 vaccines next week, which is over 6 times more than the most we've ever received. So that's some significant headway that we learned, I think, this morning or late afternoon yesterday. Stephanie, we can open up for public comment initially and then jump into any discussion or actions we need to discuss further.
Okay. If there's anyone who's interested in making public comment, you can use the raise your hand icon, or you can send me a chat and I will unmute you to make public comment. Okay, our first one is Neil McLaughlin. Mr. McLaughlin, I've unmuted you.
Hi, Stephanie. Just wondering, it's great news to hear that we're going to be getting more vaccine. And I guess the question that that poses for me is the methodology for us to get that vaccine out. So, you know, the system that's in place is working for the numbers that we have, but as we multiply that by a factor of 5 or 10, what will we need to do to change our delivery method?
Our next person is Diane Blust. And Ms. Blust, I have unmuted you. Okay, there you go.
Okay, thanks. Yeah, thank you. That's great news that we're going to be getting more vaccines. I am the sole caregiver for my 95-year-old father who has gotten his vaccine. I'm very happy about that. I, however, have not gotten my vaccine, and I'm very unhappy about that. And I would like to know, I think we need to have some type of an investigation into what went wrong in the early stages of the signups. I signed up for the vaccine on January 19th, checked about a week or so later with the health department, and they had no record of me. And that happened to a number of people. If I had been the only one, I would have just chalked it off to bad luck, but I wasn't the only one, and that needs to be investigated. The health department, after I pleaded and pleaded and pleaded, finally put me back on their list, but I still haven't gotten a call for my vaccine. And the other thing I'd like to bring up is that I did a check of the Board of Health minutes, and the county commissioner who is assigned to cover the Board of Health attended 2 out of the first 10 meetings last year. The minutes aren't up for the November and December meetings, so I don't know what happened there. I think that's a real failure of leadership of our county commission. We were in a pandemic. You know, it was clear from February on last year that we had serious problems, and to have a county commissioner assigned to be the liaison to the Board of Health just not attend the meetings is really unacceptable, and I'd like you all to look into that as well. I think you need to have at every county commission meeting a report on all the entities within the county that the commissioners are assigned to cover. There needs to be probably a written report by the commissioners. You're paid $41,000 a year. you have to earn that money. That's all. Thank you.
All right, our next individual is Teresa Chiodos. I'm trying to unmute you, Miss Chiodos. Oh, there we go. You should be unmuted now.
Okay. Sorry, Stephanie, this is actually John Maxey. Teresa went to
Okay.
get a coffee. But what we were wondering is we noticed in the paper that the 1,700 doses quoted by the state as being provided to Jefferson County, that quote could be interpreted two different ways, either 1,700 doses to our county or 1,700 doses split between the 25 counties that are under the state average. So I wonder which of those is. It's a significant difference depending on how you interpret that comment.
And I did have someone send a question to me that I'm interpreting as public comment, which is, when will the state and town, the state and county lists be merged? And I don't see any other takers right now for public comment.
Okay, so if that's fine, Stephanie. So I appreciate public comment. I know there are a lot of elected officials on, health officials and so forth. I think I'm going to start with Dr. Reedy. If you'd like to address any of these questions that were brought up, Dr. Reedy, or if you have any background you can share with us on top of what we already know.
Okay. I'll give you a little background first. We've been hoping for a few weeks to have some firm data to measure how much vaccination's been given. We know the health department has received a relatively small amount, but we're not the only entity vaccinating. Walgreens, the VA, Shenandoah Community Health Center, the school system, the hospital systems. There are a number of different entities vaccinating the people who live in Jefferson County. We only have knowledge of the vaccines that we've received. I was hoping that all these other people together would account for a lot more than they did. When the state finally was able to get that information, put it on their website the middle of last week, it showed indeed Jefferson County was not getting a whole lot more vaccines out of proportion to what the health department was getting. So we were the lowest in the state on that. The numbers yesterday, the data now is even clearer on the state website. They did put it in a table form in just the map, so you can look at all the data together. Jefferson's the lowest either for number of people who have received the first dose or number of people who have received both the first and second dose. Berkeley County is the second lowest. Morgan County is the third lowest. In the lowest 7, Hampshire and Mineral are also represented. We do know that Berkeley and Morgan are population-wise, we have younger population on average, and that's probably just because we're a growing county. Our youth are not all leaving to go elsewhere, whereas in much of West Virginia, many of the young people have left, so their counties tend to be older. That can explain some difference, but my concern now is, as we increase the amount, which we know is going to happen even if this data wasn't published because the vaccine's becoming more available, is how will we now administer 30,000 doses, 30,000 people. Right now it's 2 doses per person to get vaccinated. How will we do that over the next couple months? The health department's relatively small. We have a lot of volunteers helping. West Virginia Medicine, Jefferson and Berkeley Medical Centers are major partners in this. Shenandoah Community Health's a major partner, and there are a lot of others. The National Guard will probably be helping in some capacity. The Secretary Crouch has reassured me, and I think Delegate Espinosa has been reassured that other assistance can be forthcoming if we need, and we may well need it, but we may not. We have a very good process for administering the vaccines, but it is very involved because right now the communication is by telephone, which to reach one person often takes several phone calls. The databases are not updated. The data is a problem everywhere. In this country, we tend not to keep databases of people because of privacy, and we still have that concern. And the local public health system, as well as the state public health system and the national public health system, compared to places like Taiwan and Korea and other democracies with a different view of privacy, have these data systems. They already know where everyone is and how to reach them. And their response to the pandemic starting a year ago has been entirely different. So we're grappling with either initially just phone messages jotted down on a piece of paper, then computerized systems and large, I mean, 7,500 volunteers helping answer phones, and that's ongoing. And this has happened in all the other counties. Some places didn't keep lists. Right now, we still have a lot of people on our list. Gillian Beach can probably clarify a little better. We think there are well over 1,000 people. We have to reach each one to find out if they've gotten their vaccine somewhere, if they're still interested. The state Everbridge software, initially from the very first, they were to take our lists and merge them, but that actually turned out not to work out. So they ended up saying, don't send us your lists because we can't merge them. So we're still working off the lists. Most of the counties their lists are either depleted or there aren't many. So we will probably in the next 2 weeks, I don't know this for sure, probably in the next 2 weeks be getting lists off the state Everbridge. That has its own problems. That has not worked out as smooth as hoped. This is a use of that system that hasn't been done before, just like so much else in this pandemic. Even if things work perfectly, the vaccine supply for several months is going to not match the demand. We are trying to target the oldest first on our list. So as we get better data, we're trying to get those 85 and above vaccinated first, above those 70 and above and 65 and above. Pretty soon we will probably get them vaccinated. In Jefferson County, we've got about 3,500 80 and above and about 9,500 65 and above residents, and we're nowhere near that. But in a few weeks, if we're getting close to 2,000 doses a week, we can make up for that. One of the problems with 2,000 doses a week is very quickly that becomes 4,000 a week because we have to give a second dose to most of these people. So as daunting as 2,000 sounds when we've been doing 300, is we're really talking, 3,000 or 4,000 a week. That's a lot of vaccinations. But the specific questions asked, those who signed up on the list and didn't get on the list, we apologize for that. We're trying to make it right, that everyone who's eligible right now is from the general population is those 65 and above. We want to vaccinate every one of them. We do have to work within the rules that the state sets because that's who's giving us the vaccine. So they set the rules. And and they are doing a good job compared to other states, as far as it's not sitting in a refrigerator somewhere. It's out there. When the ice last week delayed our vaccine, as soon as it actually arrived in the state, we were notified and we were able to pick it up the next day. So it's not sitting somewhere waiting to be distributed. When it gets to the state, they're distributing it. Another question, how to interpret the 2,500 doses. I think that's what was asked. I'm not sure exactly the question, but I wouldn't know the exact answer anyway, because we don't know what we will get until they actually tell us that. And we are even hesitant, up to this point, we've been hesitant to even schedule a clinic until the vaccine's in hand. Initially, when this just-in-time delivery started, it turned out to be almost in time. So there have been, it's quite difficult to call 300, much less 1,700 85-plus-year-olds and schedule them and then postpone them. It has worked relatively smooth considering that. If someone can remind me if there were other specific questions.
I think, Dr. Reedy, I know some of the state legislators have to leave too, so if any of them mentioned anything previously, thanks for that rundown for us. Delegate Espinoza or Clark, did you have any comments before you had to leave?
I'll be happy to just speak briefly, and I do have to step away for a few minutes. We'll be happy to rejoin afterwards. But I did have, was pleased to have some productive conversations with General Hoyer, who of course is director of the Interagency Task Force, as well as his deputy, Joe Peel, and I know that Delegate Clark, Senator Rucker, our whole Eastern Panhandle delegation has really been reaching out and trying to better understand the reasons for the disparity, but more importantly, try to understand what the plan is to address that disparity. And as a result of those conversations, did receive a commitment yesterday from Deputy Director Peel that they would be increasing Jefferson County's allotment and each of the 28 counties that are below the state average. So the answer to, I think, one of the questions under public comment, my understanding is that Jefferson County's allotment will increase from 300, that's the 300 that's going directly to Jefferson County Department, to 1,780, and that's per week. And my understanding that each of the counties is going to receive an increase. I don't know the precise increase, whether that'll vary by county, but that's what we've been committed in. Certainly recognize that presents a challenge for all those that are involved in our vaccination program. And the other commitment that I received from Deputy Director Peel and General Hoyer is that the Guard and the vaccination, the joint interagency task force did stand ready to assist counties that do require help. So just would encourage you, Dr. Reedy, to be in contact with those folks and let them know precisely what we need. Hopefully they can provide some clarity as to when they anticipate having the vaccines and when they'll push those out. So again, I'm certainly not underestimating the challenges that lie ahead of us, but I think we can all agree that they're good challenges to have additional vaccine to get out to our constituents. As far as some of the questions about how the disparity arose, I mean, I certainly was interested in that as well. The short answer that I received from General Hoyer and Deputy Director Peel is that they acknowledge that the vaccination program is imperfect, and while not intentional, they believe that some of the disparities were probably unavoidable. If you look at Kanawha County, for example, that has, I believe, 5 hospitals, 11 nursing homes, assisted care facilities, a great number of first responders, I think it's somewhat understandable that would result in a considerable number of doses there. CAMC, the major hospital in Charleston, from what I understand, they when they had additional supplies or leftover supplies, they did what I think any of our hospitals would do. They directed those surplus supplies to their local health departments. that obviously, increase their number of vaccinations. And so while they acknowledge that there is a disparity, I do accept that it wasn't intentional. And best yet, they have committed to addressing it. And they've committed over the next 30 days to continue this surge of vaccines to those counties that are below the state average, so that disparity can be addressed. So I'll stop there. And again, I've got to step away for a few minutes. Happy to rejoin in a few minutes. Thank you.
Thank you, Delegate. Delegate Clark, did you have anything to add to that? You're on mute, I think, sir.
The only thing that I would add is that we also have to understand the weather that we've had in the Eastern Panhandle over the last 30 days. I know there was a shipment of second doses that were supposed to be received in the Berkeley Center Thursday and Friday, which they did not get sent because of the weather. So keep that in mind as well. As an example, I know up there in Eastern Panhandle, there's still some snow on the ground. Down here, we don't have any snow. So anytime that shipments were supposed to go somewhere, maybe they got sent other places just to get them in people's arms.
Thank you, sir. And I think we have one public comment that was trying to get through, so I'm going to jump back to that comment real quick, Stephanie.
Yeah, so he emailed me or chatted me the questions, and I think the one question has been answered, which is another commenter had that question as well, is how will the list from the county and the state be merged? The other question was also for the health department, and they were curious to know whether the health department would be prioritizing double doses or single doses. And that's it.
All right, thanks. Dr. Reedy, do you want to address that question?
So that will be a decision made at the state level and maybe at the national level, and there will be guidance about who will get which type of vaccine. Right now, my view is that whatever vaccine you can get, take. The biggest things we want is to prevent death and prevent severe illness, and all of them appear to be effective in doing that. None of them are going to be perfect, as well as permanently immunizing anybody from getting a COVID infection. So, I took the one that I was able to get.
All right, thank you, sir. And I just have one other thing to address before I open the floor to everybody else on the call. So one of the public comments was the county commission's representation at Board of Health meetings. So I'm going to propose a change to the Board of Health. I think every single county commissioner should be attending those meetings going forward. So Dr. Reedy, could you have your staff send each commissioner the link to those future meetings?
Yes, sir. We are glad to.
Thank you. All right, so at this point, I'm going to just go box to box. I see if any further comments are need to be made. Commissioner Tabb, you're the first box. Is there anything you'd like to add to this?
Well, I'm glad we have been able to reach out to our elected officials and that the doses will be increased for Jefferson County. I know there has been an organization, COAD, that has done a tremendous job of securing volunteers to run these clinics. And I encourage anyone that wants to assist to perhaps Gillian or Dr. Reedy will tell me or say publicly the best way to make that contact if you want to volunteer, because obviously we're going to need more volunteers. And I will say, I know the health department is working night and day. They're doing all that they can with the resources at hand, but there will be, I would think, a need for more volunteers.
Thank you, ma'am. Commissioner Jackson, anything?
Yeah, I just want to say I'm glad to see the state getting the pharmacies involved, Walgreens. I did speak to the pharmacist yesterday. So they're just waiting on the vaccinations one to arrive and a list of folks that are registered with the state so that they can hold a clinic. So I'm glad to see Walgreens in conjunction with the health department, addressing this and trying to get this out as quickly as possible.
Thank you, ma'am. Mr. Commissioner Stollifer?
Yes, I want to thank you, Mr. Chairman, for calling this. I think we certainly did shed light on why we're not getting the vaccinations that we need. And I also wanted to thank I know Mayor Pearson's, he's putting a lot of work in at the vaccination center at the Ranson Civic Center. He's doing a great job. They're going to ramp up some more to once we get more vaccines, and they're doing a great job over there. Also wanted to address Dr. Reedy and Gillian. We got an email from the chairman of your board asking for Michelle Gordon to assist you on some grants. The commission did agree for her to help you guys. I think there was a couple times she had plans to come over, but it was snowing and the county was shut down. I believe she's going to be over there tomorrow to help you all on some grants and some financial stuff that you're dealing with. Other than that, I want to thank everybody. Thanks, Mr. Espinosa and Delegate Espinosa and Delegate Clark for helping us out down in Charleston to try to bring this to light. I did call the governor and his chief of staff, and I haven't heard anything back from them. But we have some good people down in Charleston to bring this to light. Thank you guys. And I do have to jump on another meeting here in a little bit, so I will jump back. But if you have any questions for me, I appreciate it. Thank you.
Thanks, Commissioner Stauffer. Commissioner Hudson, do you have anything?
No, I think everything's been covered. Just thanks for having this meeting for us.
All right, and so at this point, I'll open up if anybody else on the call wants to make any comments. So just, I guess, raise your hand and I'll pick you if you're on video. And then after that, if you're not on video, we can move from there. So any mayors or anybody else need to make any comment? Helen?
Thank you, Commissioner. I just want to thank all of our leadership, state and local, for addressing our concerns about the volume of a number of vaccines that we're getting. I did have a ray of light. One of our municipal workers received a text, an email, and a call yesterday to set the vaccine up at Walgreens in Ranson for tomorrow. So that is working. Our municipal workers registered through the Evenbright and the Municipal League. So I don't know if those two, registrations merged, but that is working. And the worker explained to me that everything went very smoothly with the calling back, getting someone today. The schedule's been set. So that's working very, very well. So I thought that was a positive that everybody should hear. That seems to be coming together. So thank you for all that you do.
Thank you, ma'am. Anybody else? Jim? I think you're on mute, sir. I don't think we can anybody hear him still?
I'm still muted.
Oh, there you go.
Am I good?
Yeah, you're good.
Thanks. So we're expecting, Dr. Reed, it's 1,780 doses a week now. Did I get that right?
That's what we've heard from Delegate Espinosa. Gillian Beach, I don't know if we've gotten official confirmation of that from the state.
But that's the plan for right now. The reason is just Dr. Reedy indicated. I mean, we have an older population, particularly in Shepherdstown. I'm trying to get people there, but we have a lot of 80 and 90-year-olds, even though the population's small. The majority of those, a significant number of those people are in their 80s and 90s. So they're concerned about their health, obviously, and that's great to know that we're going to move forward. There was confusion. I mean, you don't. It's hard to fathom that the counties with the largest populations get the least amount of vaccines. But thanks for working this out today and having this. It's important. I mean, as we move forward, just the way the things are going, the transparency and the communication and providing information is really important. Thanks, Ms. Detmer. I'm glad that that they're getting on there. Our workers are concerned. I mean, when you only have one guy a shift, you don't want him to get sick. So anyway, thanks a lot. Appreciate it.
Thank you, sir. Anybody else? Tony?
Hey, I'm here with Mayor Pearson. Sorry, we were using the other link. That's why the video didn't come up earlier. But I'd like to thank the County Commission for pulling this together and for all the participants on here, and for those who dialed in who are listening and the panelists. This is definitely challenging for the whole community, not just Ranson. But I did want to say that, you know, with this ramp up, it is definitely a significant ramp up. This isn't anything to be taken trivially. And I have the mayor here with me. We have already discussed the Ranson Civic Center will be available to the health department 7 days a week. We have it already set up. We never take it down. So the Civic Center is capable of assisting with the ramp up. We can expand the hours as long as you need. One thing I'd like for the County Commission and Dr. Reedy and the Health Department to consider is if we are offered support through the National Guard, we need it. There is and I'm just preaching to the choir here because I know everyone has put in a lot of work for this. This is not going to be a 1 week endeavor. We're in it for the long haul, and the city of Ranson is committed to it for the long haul. And one of the concerns we have for the other organizations is burnout of staff, especially volunteer staff, because the city of Ranson can offer the facility 24/7, with some exceptions. The city of Ranson has the facility for you, but if we don't have the people, you know, we can get the vaccines, we can have the facility, but the success is going to rely on the people, and we don't want the people to get burnt out. And I'm speaking on behalf of the mayor. He and I have talked about this for months, if not since last year, that we would be prepared to offer that. So that's just the one bit of advice I wanted to give, and we'll support all of the effort in any way, shape, or form the city of Ranson can, and understand it's not because the city of Ranson is uniquely positioned. The city of Ranson is making sacrifices to be able to do this, but it's that important of a task. Mayor, did you have anything you wanted to add?
We've heard that there may be additional sites be implemented when the bigger number of doses are sent to the county. I think we may want to reconsider those thoughts. The mass confusion about phone calls, different sites. I think the best plan is to have more days. If you do 400 a day for 4 or 5 days, you get the 17 or 1800 taken care of. If you have 3 or 4 different sites, you got people from the county going every direction. It could create mass confusion. Again, the Civic Center is available to the health department to do whatever they need to do, whatever days we need to do it. And I do think whatever we do and how we do it, we are going to need help. And I think we need to reach out. Dr. Reedy, I think you already know that. You and I have had our discussions about this at the Civic Center. I think it's important that if there's resources available, we need to get them here as soon as possible.
Thank you.
Thank you, guys. Mayor Trainer?
I just want to reiterate that Charlestown is supporting the Ranson effort. And I agree with what the mayor just said. Well, we can supply people, you know, for the Ranson. The communications are working very well. The coordination is working well. But if we have to start dispersing to multiple sites where we're responsible for providing volunteers, I think that becomes problematic. So I just want to kind of put that out there for food for thought.
Thank you, sir. I mean, and Dr. Reedy, I mean, do you think that's a good course of action to have that strategic location going forward rather than being spread all over the place?
I do. So we're considering backup contingency plans, and just trying to figure out the logistics. So there are lots of things on the table, but the Civic Center, Ranson Civic Center is our site now, and we're just trying to figure out the logistics, and the guard and others who can help us will be, essential in this. The traffic, the parking lot is an issue which will be less so as the population getting it gets a little younger and more able, and the weather is no longer worrying about ice. But without the Ranson Civic Center, we would have had, a lot more trouble. One thing I just want to mention before we forget about it is one thing we need to do is get more people in the community to sign up on the Everbridge site, even if they're on our list. So the governor is making it clear that there's several counties that have relatively low numbers signing up, and Jefferson's one of them. I don't have that data, so I don't know what that means, but until you sign up, you're not in line. So if everybody here can, get that word out, and we can talk in the EOC meeting later about, some messaging that I think the Shepherdstown Library and others are helping others who do not have computer access. There is a phone line you can call in, but I think that's going to be an important message because the governor's bringing that up. So we want to, we want people to have access.
Thank you, sir. Is there anybody else with comments? Mr. Grant.
Yeah, thanks. I just wanted to quickly state the city of Ranson, the mayor and council has decided, they decided a couple of weeks to do every door direct mail. And we actually have in the 25438 zip code, which covers Ranson and actually a little bit more than Ranson. We sent out cards, and I still have a couple printed up that Dr. Reedy was just talking about that provides the website and the phone number, so that we can address those who don't have computer access. I'd encourage other municipalities or the county to take this up. I mean, we got them printed up. We have some here that don't have the Spanish on it because the mayor and our city council said, hey, let's get the ones out that has the more bang for the buck, put it in English and Spanish. But that's something I'd like for everyone to consider, and we already have a template for it. We have some extra cards here as well.
All right, thank you, sir. Commissioner Tab?
I found the email if anybody wants to volunteer, and I'm hoping we could come up with a central place to post some of this information for folks. And I know it's on the health department website too, I believe, but it's JC COVID, COVID volunteers, and that's no spaces, JC COVID volunteers @gmail.com. So if you want to volunteer, send them an email, and I'm sure they'll be getting back in contact with you.
Thank you, ma'am. Is there any remaining folks that would like to comment or?
Commissioner Compton, we've had some additional members of the public raise their hand. I didn't know if you wanted to go back to public comment when we were finished here, or.
That's fine. I mean, I'll allow it. We've only been at it for 30 minutes, so let's go through those.
All right. So the first person I have is Fiona Harrison, and Ms. Harrison, I'm going to unmute you, and then you need to unmute yourself as well. So it still says that you're self-muted. There, okay, you should be on now.
All right. Oh, good morning, everybody. Hi, I'm new to this platform, so forgive me for being a little slow on this. I'm Fiona Harrison. I can't see anybody on the call, but I've recognized a lot of the names that have spoken here. I just want to echo a little bit of what City Manager Tony Grant said. He kind of hinted a little bit at it, and some others did too, but we really need to think about logistics here. Unless you've been to a clinic, you have no idea the planning that goes into planning one clinic. There are no fewer than 50 unpaid volunteers at each clinic, boots on the ground, helping make this happen. There are folks behind the scenes that are spending 40, 50, 60 hours a week unpaid, trying to get these folks scheduled to volunteer and trying to get these folks scheduled for their vaccinations. If we are getting 1,780 doses per week and talking about multiple clinics per week, you are going to need hundreds and hundreds and hundreds of volunteers to make this happen. This volunteer coordination, Jane, the email address that you just spoke of is monitored by one person. So this person is now going to be getting tens, if not many tens or hundreds of emails from people wanting to volunteer. And that person is now tasked with having to schedule these volunteers. These positions, these volunteer coordinator positions, need to be paid positions. They are full-time jobs. And if we're talking again about 2 clinics a week, 3, 4, 7 clinics a week, you have no idea how many people that is going to take. We need so many more people to step up and take these roles. And there are people who need to be paid to do what all of us are doing. And I am just one of, like I said, armies of volunteers making, struggling to make this happen. So please keep that in mind. You're advocating for more doses. I get it. I want everybody to be vaccinated, but please also think about the logistics. There's a whole other realm of things that have to happen outside the building to make these people, to get these people vaccinated. So please just put that in the back of your head. Thank you for your time. Thank you for allowing me to comment. I really appreciate it.
Thank you, ma'am.
Okay, our next individual is Jack Heffestay.
Can you hear me?
We can, yes.
Okay, excellent. I'm sorry I got on the webinar a little bit late because I had a phone call, but did anyone give out a telephone number that was best to call or a site that was best to go visit to get signed up? I've made phone calls that were using numbers that were in the spirit of Jefferson, and a friend of mine gave me a link for a state sign up. I haven't received any confirmation or any response regarding either of those. So I thought if there was a new, better one for use at Jefferson County, I would appreciate it. If you could repeat it.
Thank you, sir.
I'll go ahead.
No, go ahead, Stephanie.
So all of the registrations now are through Everbridge. I don't think the health department is accepting any more names. They're doing it all through state coordination. So that's the website is vaccinate.wv.gov, and we'll put this information out on our website as well, and we'll put it out on our Facebook as well.
What was that first word? Vaccinate?
Vaccinate.
Okay.
And then the number that you call, if you prefer to call, is 833-734-0965. And again, we'll put that information on our website as well, where people can find it, and we'll also put it on our Facebook page.
Excellent. Thank you very much for the information.
All right, our next individual is Mr. McLaughlin again. Mr.
Thanks,
McLaughlin?
Stephanie. The pragmatist in me is saying from the hospital side, we need trained vaccinators and trained observers for the observation period afterwards. So as others have mentioned about the scores of volunteers we need, we definitely need someone to put the shot in the arm when they get there. So we stand ready to help in whatever means we can. We just need a little bit of notice. And I know we're not getting much of that from the state, but we got folks that are willing and ready and trained and able to put shots in the arm. So we'll just need to coordinate well so we can get them out of their normal duties for the day and get them to the clinics and ready to help.
Thank you, sir.
And it looks like we have one more individual, Miss Christine Weimer. Ms. Weimer?
Yeah, hi, thanks. I just had a really short comment. I really appreciate this, and I appreciate you taking our comments. And my comment related to the one versus many locations. I certainly understand the efficiency of one location. And I would just say we should really take into consideration people who have either difficult mobility or difficult access to transportation. That certainly doesn't have to be solved with multiple locations and probably has many ways of being solved. And maybe you're already taking it into consideration, but as I heard that discussion, I became concerned about people with either low mobility or low access to transportation. So I want to make sure that those people get spoken for because they may not have been able to make this call. So just want to say we should take them into consideration when considering either one or many sites or how we get people to the vaccination. Thank you so much for everything everybody's doing.
Thank you, ma'am. Is that all, Stephanie? Okay, so if there are no further comments from anybody, oh, we got Ranson again. Mr. Grant?
Josh, this is Mayor Pearson. After hearing all the comments and a bunch of text messages I've received in the last 10 minutes, we've got some representatives in Charleston. Is there any funding available if we hire some people to help with these clinics? Is money available that we can pay some people as we move forward with 1,780 people coming, vaccines coming in the future? Is there money available somewhere from the state that we can hire some people and pay them? I'd like to hear from Mr. Espinoza or Mr. Clark or whoever else would like to comment on that. You may not know the answer, but if you can find out, we greatly appreciate it.
Delegate Espinoza, did you want to comment on that?
Would be happy to check with the governor to see, what funding might be available. It is my understanding, I realize this doesn't help us immediately, but it's my understanding that the next round of CARES Act, which seems to be moving towards passage in the Congress, is going to include a very significant amount of funding for municipal and county governments. So I think the long-term answer is yes, but happy to explore that with the governor's staff to see what is available now.
Thank you, sir. Anything from you, Delegate Clark?
No, I just did it what Delegate Espinoza said.
All righty. All right, guys.
Said, and your support and yours too, Wayne. In the short term, if we could get support from the Guard until we get the answer about paying people to help with the clinics, not only in Jefferson County, but throughout the state, I think it would behoove of us to try to get help. I hope Dr. Reed agrees with me. I've heard it from more than one person say that we need to get these people paid, and I totally agree. The effort that's being put forth by the volunteer group, again, we volunteer our own staff. They're being paid by the city of Ranson, my public works, my police department, whoever it may be, my CVB director and her assistant. Everybody's volunteer. They're being paid. To me, the fair thing is that these people are putting in all these hours, and those hours are going to grow as the number of vaccines arrive in Jefferson County to either get them paid or get some paid people here until we can guarantee that we're going to pay these volunteers. That's my perspective on all of them. I hope Dr. Reed agrees with me.
I do agree. We are starting the process of billing people for the vaccination procedure. The vaccine is free, but the people vaccinating are allowed to charge the insurance, and this mostly we're talking Medicare at this point. That will help defray the cost of some of the workers, that's something we're committed to doing, though it's cumbersome when we're trying to get it out, but we do need the money, as Commissioner Compton and others have reminded us. People do want to get paid.
Mayor Pearson, based on our discussions that we've had, I know in the past regarding, what it really takes to put on some of these vaccination clinics, that was one of my main asks once I got a commitment from General Hoyer and Deputy Director Peel to try to address the disparity, is to be prepared to provide support for our counties, not just Jefferson, but our other counties that are below the state average. And he made a very clear commitment that they would mobilize resources in order to do that. So just would again encourage whoever has that line of communication with the Joint Interagency Task Force, I'm happy to facilitate that conversation if there's not a communication line in place, but need to communicate with them. One, I think obviously to understand when the state anticipates receiving supplies and when they anticipate delivering those to Jefferson County, and also to clearly explain what support is needed to carry out this vaccination effort.
Ms. Beach? Ms. Beach, did you have a comment? Still
It says
muted.
you're self-muted.
Okay, now I'm unmuted. Okay. I just wanted to speak to the fact that we do have a direct line of communication to the GIADF. I speak with a representative, one of the members of the GIADF every day. We are still waiting for our update with the confirmation on the number of doses that we are receiving next week. And when we get that update, we are supposed to be in communication with our representative from the GIADF to find out what support we need. But we are still waiting on that confirmation. We have not received it yet. Normally we receive this by Monday, how many doses that we're going to have for the following week, but we have not received confirmation on the information that you got from Mr. Peel, who is the director of that GIADF.
All right, thank you, ma'am. Is there any other, Commissioner Tab?
When the one caller spoke about possible transportation issues and so forth for people getting to be vaccinated, I'm on the Eastern Panhandle Transit Authority board, so I will be getting in contact with that director, especially now that we know we're going to get many more doses. What could be done on the transportation issue, because I know that can be a problem for many people. So I'll be back working on that.
Thank you, ma'am.
Commissioner Compton, I think Mr. Allen has some information to share concerning funding and municipalities getting their employees vaccinated.
All right, go ahead, Steve.
Okay, great. Number one, in answering Mayor Pearson's question in regards to funding available. There is funding available. Now, this is disaster assistance funding, just like any other FEMA disaster, such as snowstorms, flooding, and so forth. It's the way they describe it. It's DR 4117. And for Delegate Espinosa, if you talk with the State Emergency Management Division, they'll give you that information as well. But the point of contact there at State, the West Virginia EMD, is Susan Kuhn, and she is a public assistance person for grants or for disaster assistance there. Telephone number at the state office, 304-558-5380. And then you would ask to talk with Susan Kuhn. But they have, it is 100% covered through the federal government. This is a FEMA disaster declaration, but the health department would need to, if you're going to employ people, and that's one thing that you were talking about, is employing, that's 100% funding for whatever you need for the administration of the vaccines. Of course, it won't pay for vaccines, but it will pay for your staffing that is needed, required to do the vaccinations and so forth. And that includes any support staff and other areas that you need that support. Also, Mayor Detmer and Mayor Oxer, well, all the municipalities, as well as the county commission. I know there was some concern about the importance of having our municipal and county employees that are essential employees to get the vaccines. that is available. And what you have to do is when they go to register, and this was shared with our Emergency Management Council in our meeting yesterday, they shared it with us. When you're registering an event, not Eventbrite, but Everbridge, it asks for your employer, and of course for the county commission would be Jefferson County Commission, or for city employees or town employees, you would check those boxes, as well as then in the occupation box, you would insert that city or the county as well in there, and that would put them in as essential governmental employees that would step up that process to get your essential employees, your waterworks people, the garbage, and all of your different municipal agencies. But that's, once again, when you get into Everbridge, you would put in as your employer the municipality, and then what their job is or what their occupation box is, then you would put in the city or county in there. So you would be recognized as a city employee or a county employee. And that should help you in that endeavor to get more of your employees, your essential employees in there. Back once again to that FEMA declaration, DR 4517, and that contact with Susan Kuhn at West Virginia Emergency Management Division at 304-558-5380.
Thank you, Steve. Steve, just a quick question. Is there any sort of memo on that, on how to do that, or any like rundown as to step 1 to step 10, or?
In regards to on Everbridge, Commissioner?
Yeah, or anything like that.
I did. I shared that with Ms. Grove yesterday, and I can send it out to our municipalities as well. Just put in the appropriate information, but I can share that with them as well.
I'm sure that would be helpful. I appreciate it, Steve.
Absolutely.
Mr. President, I did just get a note from Joe Peel, who's the Deputy Director of the task force. He indicated that Jefferson County will be receiving information today for next week. So look for that today.
That's great to hear, Delegate Espinoza. I appreciate that. Any other comments? Oh, Jim? You're on mute, sir.
You should be good, Mayor Oxer, now.
Am I good now?
Yes.
Steve, so when you send out this, the number of Everbridge is on there, right?
I can include that in there, Mayor. Yeah, I will.
That'd be appreciated. We'll get that out today, and I'll send it to all the guys in the department heads. You almost forgot about wastewater. Don't forget about them.
Absolutely. Water in, water out. Yes, sir.
Yes, sir. So if you could send that, that'd be great. And then send it to the guys and get them to get their employees, and then we'll get moving. But it is good to hear that Mayor Dittmer got some kind of response, because I probably did this 2 months ago with the municipal league. Yeah. So that'd be great. Thanks.
Ms. Beach?
We also have some graphics we can share on Everbridge. And I'd like to make one other comment about the wait list, if you don't mind. I know we have a lot of public that have been sending us their concerns about the wait list. And the county wait list, we started ours back in the beginning of January when the governor opened it up to 80 and over. So we started a wait list here at the health department. And then the state decided to take a regional approach with the vaccine allocation, and it was only going to first 12 counties and then 17 counties that were distributing the vaccine regionally. Well, when that happened, and it was on January 19th that Berkeley County opened a link for registering on their system that they just set up for a waitlist registration system. And when that happened, we of course shared that link to give Jefferson County residents an opportunity to get vaccinated there as well. And that's how a lot of Jefferson County residents ended up on a Berkeley County wait list that we at the time did not have access to. So when they were calling to ask us about being on our wait list, we were telling them that they weren't on ours. But we have since merged those wait lists since it's gone back to just the county distribution instead of that regional approach. So we do have all the names from the Berkeley County wait list as well as the names that were on our wait list. Now we are aware that some might have been missed because we were getting hundreds and hundreds of emails every day before we had an online registration system. And that's how people were trying to sign up for the vaccine. So some of those may have been missed. And we do apologize for that. But we were asked by the state, I think it was on the 22nd, not to collect any more names for the wait list because the Everbridge was going to be launching that following Monday. So we stopped collecting names. We're not adding any more names to our wait list. We were told by the state that our wait list was going to be merged with that state system, but then later they discovered there were issues with trying to merge the list, so they told us to continue to work from our wait list while encouraging everybody who's on our wait list to go ahead and register in Everbridge as well, just to make sure that they don't get missed. And also for those on our wait list, we still want to encourage them to register in Everbridge because right now that's going to give them the opportunity to get their vaccine at Walgreens as well, because Walgreens is using Everbridge for their appointment. So just a little clarification on the wait list for everybody.
Thank you, ma'am. Anybody else? I know we're at the hour mark now. Mr. Grant?
Yeah, just a quick one with regard, so we're not, so we have hopefully a suggestion for course of action with the FEMA funding. Mr. Allen gave me that information back in January, and we, Mayor and I discussed what's the best way to actually apply for the FEMA funding. And at that time, the city of Ranson determined that it would actually be beneficial for the health department to apply for it, or the county to apply for it, since this is a county health department issue. So it's just a recommendation, and the city of Ranson be more than willing to support that effort. But just a fact here that Cable Huntington Health Department has already received 1.07 million from this FEMA funding grant. And if you look outside of the state, Maryland has already received over 219 million in federal funding to administer, and this is specifically for administration of the vaccine. New Jersey has already received over 591 million. And then there's, Oregon, there's other places that are actually getting federal funding, whether it's from FEMA or other sources. But we'd be more than willing to help out, support the county in the application for this, because Mr. Allen gave us some very valuable information, and there are other health departments already receiving funds for it. Mayor, did you have anything?
No, I just think it's important that we follow through with it now. And hopefully they accept their application. We get an acknowledgement saying that, yes, we will reimburse you for whatever you spend. But I think we need to put a plan together on getting these people paid, because we're going to do 1,780 vaccinations in the next 3 or 4 weeks, every week. If we don't get that done, we're going to be struggling, and we're going to be required or necessarily have to have people from the National Guard or someone else be here to help us. And I don't want to rely on that until the time comes, as pusher comes shove. And again, I think the plan needs to be very vigorous, because I think someone just said that you'll get contacted today telling you when that vaccine's coming for next week. So again, I think we need to be very aggressive on what we do moving forward.
Thank you, guys. Anybody else? Ms. Beach?
Just about the guard support, we have been told by our local guard members that they're going to be able to support us at our events. So we have, I think, 3 or 4 here locally right now that have been working as contact tracers in our office, and they've been, I guess, their newest direction is to help us in any way needed. So including our events. So that's a few Guard members that we know we do have right now. I'm not sure about more Guard support. That I'll find out later.
All righty. I don't see anybody else with comments. Unless I'm wrong, speak up now. So,
I think to do
go
this,
ahead,
but Mr. Breslin, who is the chair of the health department, has raised his hand.
well, I'm going to have to allow that, right?
Yeah. Mr.
Go ahead,
Breslin,
sir.
I've unmuted you and it says you're self-muted. You just need to unmute yourself. There you go.
Okay. Can you hear me?
Yes, we can.
Okay. I'm sorry. I'm using my iPhone and I'm speaking from out of town. I was just thinking, listening to all of the conversation, that it would be a good idea, because I hear a lot of comments from community members about being confused about who's doing the vaccination, where is it taking place. If either the health department or the county would put together and sort of keep updated a list of where vaccinations are available. And I know it's not just the health department in Ranson, but you've got Walgreens, and I believe Walmart is getting ready to go as well, and there may be other places. So I think we should encourage community members to sign up. But then I think there's probably some confusion if you sign up with Everbridge, and do you have to also sign up with Walgreens or Walmart? And if you don't do that, how would you know that you're going to get a vaccination from either Walgreens or Walmart or the health department? So I think some sort of document or that puts together everywhere that you in the county that you can get a vaccination, because we want to get shots in people's arms as quickly as possible. And I know the health department is carrying the majority of the load right now, but any help we can get from the big pharmaceutical, the big drug stores or even the small drug stores would be very much appreciated. Thank you.
Thank you, sir. And Stephanie, I don't know if we're able to maybe get in contact with these folks doing the vaccinations as to, hey, it's Sunday this week. This is where all the vaccination clinics will be at this week or something like that. But Ms. Beach?
Just one issue with that, and we've experienced ourselves, is that these clinics are all by appointment only, and they're using wait lists to schedule the appointments, so people cannot just show up at these clinics. We are advertising when we're having the clinics, and I don't know if Walgreens is or not, but for Walgreens, you're not signing up at the local Walgreens. They're using Everbridge to schedule those appointments. So everybody just needs to register in Everbridge and wait until they're contacted for an appointment. We can advertise when the clinics are, that's fine, but we've already had issues with people that do not have appointments showing up trying to get vaccinated. And we're not going to have extra doses to give to somebody who's not already on the wait list. We have people in standby waiting for any possible extra doses, and that's for people that don't show up, aren't able to because of whatever their reason might be. But if we have any extra doses, we are using our wait list with a standby list of people that are already there waiting to get that vaccine. So there's no real point in letting everybody know where it's all taking place, other than to let them know, yes, we are we are vaccinating the community, but it's not that everything is by appointment only. You can't show up anywhere and just get a vaccine.
Thanks, man. I guess the big thing is to get Everbridge out and make sure everybody signs up on Everbridge. I mean, that's obviously the key thing here. So however you can do that, municipalities, county, and so forth, let's stick it wherever we can, everywhere. Any further comments? Okay, seeing how there's no further comment, Nathan,
Josh,
did you have?
Yeah, could I just point out, and what lawyers typically do is they come along and they're like a wet blanket on stuff. So I couldn't resist the opportunity to do that. Seriously, while the municipal folks are on here, I would just suggest that you may want to explore with your various insurance coverage folks what the parameters are about coverage in this with relationship to these things. I've been trying to do that with our insurance company, but you know, it's always good to know upfront what that is so that you don't get any nasty surprises if something were to happen.
Thank you, Nathan. Good point. So anything further from anybody? All right, so I'm just one last closing remark by myself. Just so the public is aware, the moment that local officials and staff heard about this vaccine shortage in the county, we were right on top of it. The reason we're having the meeting today at the county commission is because we need 48 hours per the Open Meetings Act to schedule a meeting. But we have been on top of it behind the scenes. I know all the mayors, myself, and the other commissioners have been calling the governor's office, and our state representatives have done a great job trying to push this thing forward. Many things in life are very partisan. This is not one of them. We should all join together and get our fair share of vaccinations to ensure the health and well-being of our residents. Going forward, I am more than happy to call another meeting like this for updates, and maybe we should. So keep track of what's going on. We'll be in contact with the municipalities and so forth. All that being said, hopefully those vaccinations show up as they've said they will, and we'll go from there. So everybody have a good day, and we'll be in touch.